Good afternoon, everyone. We are officially live for the first Ask Me Anything session at Clearing. I'm Dr. Jacob. Nice to be here with everyone. And I think what we'll do is take a few minutes for people to join. And I believe we should be, I believe if you're here, just announce yourselves. Let me just take a look at we have one viewer. And hopefully we'll see the questions coming up for the Ask Me Anything. Down in the comments is where you can start to put the questions, and we'll go ahead and do our best to answer them. We're going to focus today's discussion about pain, chronic pain specifically, but really any topic that's related to pain. A couple of sort of disclaimers. Since this is, we don't want to be providing, we're here to provide medical information. So none of the things that we'll talk about today should be or could be considered direct medical advice for a specific person. But we're hoping to educate you all and get some of the common questions about chronic pain answered. We had quite a bit of questions that came in through various channels, a number that were posted on the Facebook group. So that's great. We'll try to get to those questions. I think we'll start with those but we'd also encourage the audience to put more questions up in the comments, and we'll do our best to get them addressed. And we have one comment. Let's see, where can I see that comment? Hello, hi Magnus, thank you for the comment. So looks like we will be notified when new comments or questions come in, and then we'll do our best to answer them. Let's go back. Why don't we get started here? So again, for everyone joining, I'm Dr. Jacob. I am a neurologist and I'm a pain management specialist at Clearing. I'm also the co-founder of Clearing, which is a digital healthcare platform designed to treat people who are living with and suffering from chronic pain. And this Facebook group is really a community for social support for people who are living with chronic pain. And so hopefully we'll get some good questions, and why don't we get started? This is a question that came in from a member of the group on Facebook. The question is, will there ever come a time when this medicine could be in a patch form? So thank you very much for that question. And so let's just talk about that for a moment. And for those of you who are not familiar, the reference here, the medicine that we're talking about is some of the medications that Clearing prescribes to their patients who have chronic pain. And so that medicine, the medications that we prescribe are called compounded topical pain relief creams. And so, first of all, what are those? Compounded creams are essentially a combination of a variety of different medicines that are used to treat pain, both orally and topically, and they contain FDA-approved ingredients that are used to treat pain. And so, for example, we know there are several classes of medications that we can use to treat pain. There are anti-inflammatories, there are muscle relaxers, there are nerve pain medications. And so the way that compound creams work is they take elements from the different families or categories of medicines for pain, and we bring them together in a single formula. And so rather than delivering that formula orally through the mouth, we are able to deliver that topically directly to the area where a person has pain. And so why is this important? When you take medications orally, the medicines are absorbed in the stomach and they get into the bloodstream, they go through the liver and the kidneys, and so they go through multiple different areas of the body, And at every point, there is the possibility that that part of the body is affected by the medication. Also, as the medicine travels from one area of the body to another area of the body, there is degradation. So the amount of medicine is actually decreases. And so the result is when you take medications orally, a percentage of it, only a percentage of it actually gets to the area where you need the medication. And so with the associated side effects, the systemic side effects. And so a couple of the advantages of using topical pharmacotherapy is, number one, the side effect profile is a lot lower. It's a lot smaller. And so we can actually take medications and deliver them directly to the area where the problem is. And the second advantage here, well, those are actually two advantages. Number one is the targeted therapy, the targeted nature. We can take the medicines and really put it on the area where the pain is the worst. And two is the decrease in the side effects. And so this is the medication that the question is referring to. Now let's take it back for a minute. What was the question? The question was, are these medicines, can we deliver these medications in the patch form? So the answer to that question is yes, we can, but it probably doesn't make sense for us to do that. And there are several reasons why. An advantage of having a cream versus a patch is the cream is more versatile. It's difficult to put a patch on your hands, for example. It's difficult to put a patch on your feet. It's a lot easier to rub a cream on the hands and on the feet. So that's advantage number one. Number two is the surface area. It's much easier to cover a larger area with a cream than it is with an individual patch. And finally, patches are great for very focal pain, but there are some limitations, and there's limitations in terms of how long you can wear a patch for, and patches tend to fall off if a person develops sweat on the area or if the patch gets wet. And so although it is technically possible to have patch forms or compounded patches for pain relief medications, the benefits of topicals like creams seem to outweigh the benefits of patches. And we see that we have a new comment. This is a comment from Patty. Thank you very much for a question. And the question here is there a better drug to treat people with fibromyalgia? And I had to go off Lyrica cold turkey. So that's a very good question. And I think the question is very specific to medications. Patty, thank you very much for that question. Really appreciate it. Let's talk a little bit about fibromyalgia. Fibromyalgia is a condition that can affect really anyone. There are actually two life cycles where fibromyalgia is more common. Between the ages of 20 and about 40 years old, and then there's a second peak around the 60 to 70 year range. The prevalence this is a disease that's more prevalent amongst females, although it does affect males as well. And the manifestation of the condition is kind of a generalized diffuse pain in the body. It generally affects the joint areas and some of the key muscle groups around the neck, the back, specifically the neck and the back, but also throughout the extremities as well. And fibromyalgia is a tricky condition because there really isn't a very clear biological basis for the condition. Now, that's not to say that the symptoms are not real. They're very real. I've treated thousands of patients with fibromyalgia in my career, and the patients, this is a very ailing condition. But it's difficult to treat because we have failed, the medical system hasn't been able to find a chemical basis for the condition. And so that's very different than a condition like arthritis, where you can kind of get an x-ray, you see that there's arthritis there, and you say, okay, the arthritis is the problem. This is a condition that is a generalized condition, which modern medicine hasn't been able to detect the cause of the problem yet. And I say yet with a lot of optimism, because I do believe that with some of the advances now happening in modern medicine, that we will find the biological basis for this condition. And so the question was around Lyrica. Is there a better medication? So the answer is yes. There are multiple medications. And it's, I don't think the right question is there a better medicine? I think the right question is there a better medicine or combination of medicine and treatments that is right for the individual? And the answer there is always yes. The right approach to treating any type of chronic pain condition has to be a personal approach. We have to consider the way the pain affects a person's body, mind, and social well-being. And that really is the most effective form of therapy for fibromyalgia or for other chronic pain conditions. And so Lyrica is just one example of a medication that can be used to treat fibromyalgia. There are pretty much every class of medicines that we use to treat pains: anti-inflammatories, muscle relaxers, antidepressants, nerve pain medications, all of them can be used to treat the symptoms of fibromyalgia. I also always recommend in the treatment of fibromyalgia that a person have some form of therapy that is targeted towards their mood. And unfortunately, being in chronic pain is just not a happy state. And it is really important for a person to take care of both their biological health, right, their joints and their bones, but also their mental health. And being in pain for a very long period of time and not having the answers that we need can be taxing on a person's emotional health and mental health. And cognitive behavioral therapy is a form of psychotherapy where the basis is change the way you think to change the way you feel. And that is a very powerful tool that can be used in combination with medications to treat fibromyalgia. Thank you for that excellent question. I see we have some more comments coming in. We have a question from Star. Thank you so much for the question. The question here is, when I wake up each morning, pain is so intense in my lower back / sciatic nerve that I can't take a deep breath. If nerve endings had a voice, mine would be screaming. Is there a better approach to applying the cream so I can avoid waking up that way? That's a great question. So I think here the question is around lower back pain and sciatica, and how can we prevent how can a person wake up feeling better? Let me approach this from a slightly different angle. I think it's important to, I think what we're really trying to say here is what are some tips and tricks that we can do to wake up feeling better? And I apologize if I mischaracterized the question, and I'll try to go back to what you were asking about the cream later. But I think this is just a general great question, a good piece of advice. It's a great question, and I'd like to provide some advice. As a neurologist, I talk to people a lot about sleep hygiene. And getting a good night's rest is actually a predictive factor, can actually decrease a person's perception of pain. And so after a good night's rest and sleep, our tolerance for pain actually increases, and the amount that pain bothers us decreases. And so having a great restful sleep is extremely important. So what can we do to get ourselves to a better night's rest? Let's start with that, and then we'll pivot to the specific question about the cream. So when I think about the sleep cycle, I like to think about the day cycle first, right? I think it's really important for us to start our day off at a specific period every single day and try to make that consistent. And so if you like to wake up at 8 o'clock in the morning, go ahead and do that, or 6 o'clock in the morning, do that and be consistent. And even on the weekends when we have an opportunity to rest a little more, even if you need the extra 2 hours of rest, try to wake up at the same time that you normally wake up during the week, walk around the house a couple of times, and then go back to bed. So this is the first step in regulating a person's sleep cycle. Next, any type of a stimulant that we drink, that we expose ourselves to, caffeine, soda, chocolate, for example, try to keep that into the first half of the day, so that going into the second period of the day, we're not overindulging in things that are stimulants that can keep us up at night. Next piece of advice: try not to take naps during the day if possible. Naps during the day can actually interfere with our ability to get into a deep sleep at night, and so try to avoid them during the day as much as possible. Exercise, let's talk about that. Exercise, in my opinion, is best done in the morning hours. And so this way, we have energy from the previous night that we expend in the first half of the day, and that the second half of the day becomes a slow transition, so that we're preparing ourselves to be in a state that we're most prepared to rest in the second half of the day. So we spoke about no naps during the day. Meals. Try not to have big meals very close to bed, and that also goes for alcohol as well. Try not to have too many alcoholic drinks, or any at all, in the second half of the day if possible. And if you're going to, try to bring those closer to this 5-6 o'clock time period, so that in the 8, 9, 10 p.m.s of the evening, there isn't a full stomach or any type of alcohol in your system that will interfere with your ability to sleep. The room, the bedroom. Make sure it's dark. There are no distractions. Television shouldn't be in the bedroom. Your telephone shouldn't be in the bedroom. And if you say, well, my telephone is my alarm clock, I need it in the bedroom, buy yourself a $3 electronic alarm clock on Amazon and leave it in the that in the bedroom to help you wake up. The bedroom should be a place for sleep and rest, not a place for stimulation. If you have pets, keep them out of the bedroom. If you have windows and it's noisy outside, keep them closed, and try to keep the temperature of the bedroom cold, or on the colder end of things. If you're too warm, that's not actually a great way to get a good restful sleep. And finally, if you're in bed and you're just not able to fall asleep, get up and leave the bedroom. Go into the living room. Dim the lights a little bit. Get a book and read a book until you're feeling yourself tired and ready to go back into bed. And the reason that that's important is because sometimes not being able to fall asleep can cause anxiety and makes us toss and turn, and that's just not a good recipe for restful sleep. And so take these pieces of advice during the day and try to translate them, and to hopefully get a better night's rest, and see how you feel when you wake up. Those are some kind of general pieces of advice. For Star specifically, who's said she's waking up with back pain, pain in general, morning stiffness, which is a very common complaint amongst people who have chronic pain and arthritis. Morning stiffness is very common. And the reason that people experience morning stiffness most of the time, I'd say the majority of the time, is because of arthritis. People who have arthritis, after a period of prolonged immobility like sleep, the joints of where the arthritis is start to kind of stick to each other. And so by moving and starting to move in the morning, that's when the pain starts. And if you notice, oftentimes the pain decreases throughout the course of the day. And so my advice there is to do a few things. Number one, try to do some stretching and exercise before getting into bed. Not exercise like the type of exercises we spoke about to do in the morning, the cardio exercises that get you revved up. But a light stretching session, maybe some yoga, some bends and twists as tolerated, that target specifically the area of pain before you get into bed. Try to do that regularly, and see how you feel the next day. You may have to find the right exercise regimen that works best for you. In terms of applying the cream, you can also try to apply medicine in the evening before bed and in the morning before getting out of bed. And so I would encourage you to try doing that as well to see if that helps. Great, let's see if we have any other questions here live. And Star also says pain makes you grumpy. That is true. That is absolutely true. Pain can affect the way we feel and the way we think, and it can definitely impact our mood. And so, I think the first step towards healing is recognizing that pain itself can actually take control of other areas of our body, not just the biological issues. It can also affect our mind and our social well-being, and just being aware of that itself can be the beginning of the healing process. And if you know that pain makes you grumpy, trying to come up with solutions to sort of recognize I feel grumpy now, and I'm tying this specifically to my pain, and try to put that in a box and think positively and not let it put you in a negative cycle of automatic thought patterns like I'm in pain, my pain will never get better, why is this happening to me, I'm going to have to live like this forever. Just stopping yourself at the beginning and saying I'm in pain, this is bothersome, I feel like this pain could affect my mood, but I'm not going to let it. I'm going to move on. And obviously that's easier said than done, but I definitely recommend practices like mindfulness, yoga, meditation, and cognitive behavioral therapy, all of which kind of can help empower an individual with the tools needed to break those negative thought patterns and feelings. Looks like we have another question from the group. This is from Jess. Are there certain types of food that can help reduce pain? That is a very, very good question. I think, I actually believe we have an article on this on our blog, and I think it's called Anti-Inflammatory Foods, and I encourage everybody to go check it out. That's clearing.com/blog. And there you hopefully should be able to find an article about anti-inflammatory foods. But to think of food as medication, I think is correct. I think it's definitely the right thing the right way to characterize food. Food can be medicine. Right? We know foods, for example, that are high in fiber can help with our digestion. Foods that are high in polyphenols, for example, which is an anti-inflammatory, can be used to treat inflammation. But the question here is, can food specifically help reduce pain? And I don't know if there's a right answer to that. I would say theoretically yes. And if the follow-up question is, well, which foods? I think that's a much more difficult question to answer. What I would say is having a healthy diet, right, and versus a non-healthy diet, and maintaining the right weight and the right body mass index is really important when you're dealing with chronic pain. And if you think about it from a mechanical perspective, more pressure and more weight on joints that have arthritis are going to increase the load on them and actually make it more difficult for add stress to already stressed parts of the body. And so if a healthy diet where you maintain the right amount of calories, not too many calories, not too few calories, but a balanced diet with the right number of calories, or even a slight caloric deficit, so you head towards a weight which is appropriate for your body habitus, I think is a really important way that we can think about food as being medicine specifically for decreasing pain. And if you have knee pain, for example, and you're overweight, you're carrying too much pressure on those joints, the first way to really think about treating that is, how can I take the pressure off of those joints? And so maintaining a healthy diet is a great way to do that. I hope that answers the question. And for more tactical advice about specific foods, I refer you to our blog post on anti-inflammatory diet. Great. Patty, thank you again for the next question. Patty says she's been diagnosed with fibromyalgia, but also rheumatoid arthritis. Rheumatoid arthritis is a crippling disease that can be worse with fibromyalgia. What can treat both with less side effects? Very good question. So, rheumatoid arthritis is an autoimmune disease, which means it is a disease where the body actually creates antibodies. Now, most people, if I said the word antibodies 2 years ago, most people would probably not know what I'm talking about. But now with COVID, and there's a lot of talk about antibodies, and so I think most people have heard the word antibodies. But what are they? So essentially, these are little proteins that the body creates to mark different parts of the body as problematic, and it mounts an immune response. So the immune system starts to go and attack those areas. And so in autoimmune diseases, so when, for example, let's say if you have a virus, antibodies will target the virus, and then your immune system will go and kind of destroy the virus, so you will heal. In an autoimmune condition like rheumatoid arthritis, the body creates antibodies for its own tissues, healthy tissues. And in this case of rheumatoid arthritis, it attacks the joints. Now, when you think about treating an autoimmune disease, it's very important to treat it in collaboration with a rheumatologist or a person who's an expert in joint disease, who has familiarity with autoimmune conditions. And the way that we manage autoimmune disease is to suppress the immune system. We actually can use medications, and there are a long list of medicines for rheumatoid arthritis specifically that target the immune system and the immune response. Now, that's very different than fibromyalgia, because as far as we know, we cannot yet characterize fibromyalgia as a true autoimmune disease. And we don't have good evidence to suggest that if you suppress the immune system, that the symptoms of fibromyalgia improve. And so rather than focusing on the autoimmune versus non-autoimmune processes, because so rheumatoid arthritis and fibromyalgia are dissimilar in that regard. Rheumatoid arthritis being autoimmune, fibromyalgia being, at least as far as we know, not an autoimmune disease. But there is a common linking factor. Can everybody guess what that is? Can anyone guess what that is? The factor that links the two diseases is the symptom of pain, right? Pain is a symptom, and chronic pain syndrome is also a disease state itself. It's its own condition. Well, let's focus on the symptom for a moment. Rheumatoid arthritis, the joints, when there's an autoimmune reaction against the joints, that's painful. And as the joints degenerate, that creates pain, and that causes a lot of pain. The same is true with fibromyalgia. People who suffer from fibromyalgia, their whole body hurts them, right? And so, how do we manage this? Well, it's never a bad time to manage the symptom, right? Even if we're not 100% sure what a person is dealing with, pain-wise, pain is cryptic. It's not something that read the textbook. It doesn't always correlate necessarily with imaging and with blood tests, and it's often difficult to find the root cause of a chronic pain problem. But that doesn't mean that we shouldn't treat the symptoms. It's always important from early on in the condition, from the moment pain starts, it's always best to start treating the symptoms right away. Because if we leave symptoms untreated, they're at a higher risk of chronifying, so meaning lasting for a long period of time. And there's a much higher likelihood that they'll start to affect our mind and our social well-being, right? When you're in pain and the symptoms are untreated for a long time, you don't want to go out with your friends. It's painful. It hurts. You never know when you're going to have another attack. That affects our ability our social life, right? It also affects our ability to go to work, sit down in front of a computer and do things or do manual labor. And so the longer we have the symptoms, the higher the likelihood that it'll last for a longer period of time and that it'll affect other areas of our life, which we hope it wouldn't affect. And so the answer, I think, is the way to treat both conditions, at least on the surface, is to manage the symptoms, manage the pain symptoms. That's not to say you shouldn't also see a doctor who's a specialist in autoimmune disease, to make sure that if someone does need immunosuppression to suppress the immune system, that they get that done for them. Great question again. Let's see, if we don't have any questions coming in right now on the chat, I can go over to some questions that we've had that were sent in from us. Here's a question from another member of our community. This came in, I believe, through email. This is an anonymous question, I believe. I've been told chronic pain in my hips and back is caused by damaged nerves in my back. 10 back surgeries and 12 years with Parkinson's. What is your solution? Because not one doctor I've talked to can fix it. They just put a bandage on it and has been prescribing pharmaceutical poison. So that's a good sort of comment and question that we can open up here. Let's start with the first half of the question, which is, I've been told my chronic pain in my hips and back is caused by damaged nerves in my back, 10 back surgeries. So it sounds like you're experiencing back pain and leg pain or hip pain, and have been told that this may be due to some form of a nerve problem in the back. Now, of course, I don't know, I've not examined this person or seen any of their imaging, but first of all, can back pain and leg pain be caused by pinched nerves in the back? The answer is yes, absolutely. Are there other things that can cause back pain and leg pain? Yes. There are many different causes of back pain and leg pain, including muscle problems in the back and in the legs, including joint problems in the back and spine itself, like arthritis of the joints of the spine, arthritis in the area that connects the back to the leg, the sacroiliac joint, the sacrum, the pelvis of a person can be a pain generator, the muscle surrounding the pelvis and the gluteus muscles, the buttock region muscles, all of these can cause pain. As a matter of fact, hip pain can actually refer and radiate up to the back and spine and to the groin as well, and the leg. And so pinched nerve is one cause of back and leg pain. There are multiple other causes of back and leg pain. And in your case, it sounds like this person's case, they've also had 10 back surgeries. 10 back surgeries is a lot. That sounds like a lot. Quite frankly, if it was me after 2 surgeries and I hadn't seen any success, I probably would have been very careful to have another 8 back surgeries. And so I'd want to kind of really understand what those back surgeries were and what they were targeted for. But people who have had back surgery for pain and the symptoms don't get better, they fall into a different category. And that category is called failed back surgery syndrome, or failed back pain. Essentially, all that means is you've had back pain and leg pain, you've had surgery and you didn't get better, or you got better for a period of time and then developed a new problem in the same area where your pain was affected. And that's a condition called failed back syndrome, or post laminectomy syndrome, if you had a laminectomy, which is a type of back surgery. And you also mentioned that 12 years with Parkinson's. Now, pain is difficult to treat in a person without Parkinson's. And Parkinson's, for those of you who don't know, is a disorder that affects movement, and it can cause stiffness. The acronym is TRAP, T-R-A-P. T is for tremor, R is for rigidity, A is for akinesia, and P is for postural instability. This is the acronym that we think about for Parkinson's disease. So what does that mean? People develop tremors. That's the most common symptom of Parkinson's. But people with Parkinson's also develop rigidity. Their body feels stiff because it's hard to move. Akinesia, which means slow movement, and then instability with their posture, postural instability. Let's focus on rigidity for a moment. When a person feels rigid and stiff, this is rigidity that comes from the brain. it makes it difficult to move, to get around. And so you can imagine rehabilitation from a spine surgery, which involves movement and exercise and activity, is more difficult to is much more difficult to do if you have Parkinson's disease. So what is our solution? Because not one doctor I've talked to can fix this. They just put a bandage on it by prescribing pharmaceutical poison. So the answer is, unfortunately, there isn't a cure for every problem in medicine. There just isn't. Unfortunately, in arthritis, there is no cure for arthritis yet. And I say yet optimistically because I do believe now with new stem cell therapy, PRP, for example, there is a bright future for arthritis. But for the moment, in the current moment, there just isn't a cure for arthritis. And so the same is true with surgery that happened in a person's spine. Once you've had surgery in your spine, the surgery doesn't ever, the spine doesn't revert back to pre-surgery conditions. And it'll always have scars from the old surgery. And so, and to date, there just isn't a cure for every single problem. There also isn't a cure for Parkinson's disease yet. And so much of the treatment around these types of conditions is symptom management, right? And so we focus away from curative medicine and we focus more on how do we help a person find ways to live better and feel better, right? Because ultimately, if something can't be fixed and we have to live with it, how do we do that better? And so the approach of clearing is a holistic approach. It looks at not just the body and the mechanical parts of a person, but also the mind and the social well-being of a person. And we deliver this in equal parts. We strive to treat a person's body using safe and targeted topical pharmacotherapy. We try to help empower a person with the means to manage the mental impact that the symptoms have on themselves. And we're trying to build community to foster social support system for people who are living with chronic pain symptoms. And so our approach focuses very much on symptom management and helping a person find ways to help themselves feel better and live better. Very good question. And thank you. This is an email that came in from Jesse from Florida. I've been suffering from chronic back pain for more than 10 years, and I've seen many specialists before coming to clearing. My question is, why couldn't my doctors ever figure out what's wrong with me? Very good question. The answer is, it's hard. Pain is cryptic. It is not like an infection. Generally, if a person has an infection, we can isolate a bacteria, we can find an antibiotic that treats that bacteria, prescribe an antibiotic, the bacteria goes away and the problem is gone. Pain is a lot more complicated and it's a lot more mysterious. Pain, the perception of pain happens in a person's brain, actually. So if a person has knee pain, for example, you have to think about it from the perspective of where does the pain actually become pain? And so if a person has arthritis in their knee, the pain only exists once the symptoms, the problem from the knee is transmitted through a series of nerves to the spine and from the spine to the brain and interpreted in the brain, right? And so if you think about pain as our mind's interpretation of what's happening in our body, I think you can start to realize that there really is pain is really a very individualized and personal experience that is affected by a person's mind and the way and their thoughts. And the same way different people think differently, different people feel differently. And so why has no one been able to find out what's wrong with me? I think that's the question. And the answer is pain is complicated. It's cryptic. And there was a study that looked at 100 people with no pain, no symptoms of pain. And what they did was they got MRIs of this 100 persons, these 100 people's spines, the whole spine. Turns out, in greater than 50% of the normal people without any pain, there were signs and symptoms of arthritis, and in some cases, severe arthritis in the spine, and herniated discs and pinched nerves. But the people were asymptomatic. Now, the opposite was true also. In a series of patients who were in pain, only about half of them had obvious and clear correlative symptoms on the imaging studies that they did. And so what that tells us is that an image or a test really isn't enough to figure out what is wrong with someone. And so unlike a pneumonia, where you can get an x-ray of a person's lungs and say, oh, there's a consolidation, there's a pneumonia. Pain, the symptoms and the imaging and the symptoms and the physical exam findings, the symptoms and the blood test don't always correlate. And so that's one of the reasons why pain is so difficult to diagnose. Now, I would also say that not every doctor has specialty training in the diagnosis of complicated chronic pain problems. And that's really, a skill and an art that requires specialty level care and very personalized approach. Before I started clearing, I would train and teach the residents and fellows in a hospital. It was part of one of the largest training programs for pain medicine specialists, I think, in the country. And this idea is a very difficult thing to teach. That the symptoms and the imaging and the physical exam findings don't always correlate. I think it's a powerful tool, because if we take that we consider that, and we consider the fact that our interpretation of pain, the way that our brain processes the pain signals, it happens up here. It really, what that really means and tells us is that if we can change the way we think about the symptoms, we can also potentially control the way we feel about those symptoms. And that's a very powerful tool. So pain is cryptic, it's complicated, it doesn't always correlate with the imaging and the blood tests and the physical exam findings, and it does require specialty level care. So you're not alone. You're really not alone. There are many people out there with chronic pain who, they go undiagnosed forever. And it's really unfortunate when people wait for a diagnosis to start treatment, because you can go years and years and years of suffering without ever just managing the symptoms. And so at Clearing, we believe that at day one, we start by managing the symptoms in addition to the rest of our holistic approach. Great question. Thanks again for that. Let's see what else we have. No more on the comments, but we do have a couple more questions here this was a text message that we got from Michael in Michigan. Oh, did we get a new comment? Well, we'll take that after. I'm just gonna stick to Michael's question for now. I've learned to live with bone-on-bone knee pain for the last 3 years. I'm too young for knee surgery, apparently. Lately, it's been hard to concentrate at work, hard to fall asleep at night. I have high blood pressure. Why do I have so many things going on at once? That is, that's a great question. And I think the question really is, why does it feel like there are so many things going on at once? You mentioned you have knee-on-knee arthritis and that you're too young for surgery. And so, what does that mean? Well, the prosthetic knees, the knee replacements that we have currently. Again, I'm not an orthopedic surgeon, but I've worked very closely with orthopedic surgeons and I've dealt with this problem specifically a lot. If you have bone-on-bone arthritis in the knee, there are many non-surgical options for treating your pain. And so if you see a doctor and the first, suggestion is knee surgery, I would make sure that you have exhausted all of the conservative therapies first. Would want to make sure, if a person comes into my office and says, I've been recommended for knee surgery, it's very important for me to make sure that that all of their symptoms have been, that all of the conservative therapies have actually been exhausted. And what are conservative therapies for knee pain? So first of all, there's physical therapy and bracing, right? No medicines, no pills, no injections, just therapy, exercise, and bracing. Number two, there is topical therapies like compound creams, like non-compounded creams, like botanicals, like menthol rubs and creams, things that can be used to mask the symptoms. By the way, if you have knee pain, arthritis is not always the cause. Sometimes it's something very simple like getting yourself a new pair of shoes can make a very big difference for people with knee pain. But assuming that you have knee pain from arthritis, right? After topical therapy, you can consider oral pharmacotherapy. There are anti-inflammatories that can be used, or nerve pain medicines that can be used to treat knee pain. Then there's a series of kind of semi-invasive things that can be done, like, for example, cortisone shots in the knee, cortisone injections into the knee, or gel injections into the knee. And a third category of interventional therapy for knee pain, which is a series of nerve blocks for the knee, which is something that we did quite a bit of in clinical practice. The knee has several nerves that surround it, and we can actually block those nerves temporarily to provide relief for people with knee pain. But the question is, if a person needs knee surgery because of bone-on-bone arthritis, assuming that they've exhausted all of those therapies, what does it mean you're too young for surgery? Well, the prosthetics that we have a life cycle on them. You can replace the knee with metal, but that metal typically only lasts for about 10 to 15 years. And so if you're in your 40s and you have bone-on-bone knee arthritis, early 40s, you may need to get a surgery in your 40s and then another replacement surgery when you're 55. And so generally speaking, we try to, surgeons try to avoid surgery for a long time. Now, the question is, you find it hard to concentrate at work, it's harder to fall asleep at night, and you have high blood pressure. None of this surprises me. Being in pain can affect the way we think and our mood. And having a negative effect on someone's mood, one of the symptoms is difficulty concentrating. And so there are many other reasons why you can be having difficulty concentrating. And so if you're having issues with concentration, I definitely recommend that you speak to a provider about that. But if we assume that this has something to do with the fact that you have chronic pain, then chronic pain can definitely affect our ability to concentrate, especially if the pain is keeping you up at night. You mentioned that your sleep quality is not very good. If you can't get a good night's rest of sleep because of pain or for other reasons, that will bleed over into your day and can affect your ability to concentrate. And the constellation of things that we just mentioned could cause your blood pressure to become elevated. Sleep deprivation can cause increases in blood pressure. Being in pain, having a chronic pain condition, can increase your blood pressure. Taking 2 NSAIDs, anti-inflammatory medicines, to treat the pain too often can increase your blood pressure. And so this is a cycle of symptoms that start to form what we call a syndrome. And sounds to me like you may be experiencing chronic pain syndrome. Now, what is chronic pain syndrome? To be very concise and brief, this is a condition where pain chronifies. It lasts for a period longer than, let's say, 3 months, depending on what textbook you read. but it also starts to affect the person's mind, ability to function in society, and their social well-being, and other areas of their medical health. And it sounds very much like that pain can be at the core of a lot of their problems. And so focused on managing expectations, management of your mental health, your sleep quality, and your symptoms, I think will all be very important to you. Great question. I did see a couple of comments come in from the group, so let me try to see if we can get that. This is a question again from Patty. Is methotrexate used for rheumatoid arthritis? Wasn't it used as a cancer treatment? That's a good question. The answer is yes, methotrexate is used for the treatment of rheumatoid arthritis. It can also be used to treat some forms of cancer. The biological basis is immune suppression, but there are plenty of other medications that can be used for the treatment of rheumatoid arthritis that are non-cancer agents. But the point that you're bringing up is actually a really good one. There's this, different medications can actually be used for different purposes throughout medicine. We see this in pain a lot. One of the most effective therapies we have for chronic pain are antidepressants. Not at the same doses that we use to treat depression, but at different doses. And so patients will often come to my office and say, hey doctor, why'd you prescribe me an antidepressant? I'll say, I didn't. I prescribed you a pain medicine. At this dose, it's a pain medicine. At a higher dose, it's an antidepressant. Now, some people come to my office and say, doctor, I suffer from chronic pain and it's affecting my mood. And so I'll say, well, I got a great idea. Rather than treating you with two medicines, one for pain and one for mood, why don't I try a medicine that is used in some instances as an antidepressant, but in other instances to treat pain? Maybe we can kill two birds with one stone. And I've seen some of the best effects with some of those medications. Great question. Thank you for that. Looks like we have 8 minutes left. Any of the other viewers want to ask any questions? Be happy to take them. If not, we do have another. We do have two more questions that came in from the group beforehand. And so I'm not seeing any more comments. So thank you, Star. Yep, don't be shy, group, please. If you have any questions, go ahead and ask. Here is a question from, we got one. Wonderful. Darlene is asking, how do you deal with CRPS? So that is a great question. Thank you, Darlene, for that. And I think that's a great way to end spend the last 7 minutes talking about CRPS. What is CRPS? For those viewers who don't know what CRPS is, it's an acronym. It stands for Complex Regional Pain Syndrome. CRPS is a very it's a disease that's not well understood, but we know that it has to do with overactivity of part of the nervous system called the sympathetic nervous system. And so what is CRPS? It's just as the acronym states. It's complex, it's complicated. It's regional, meaning it generally affects an area of the body. So it's an arm or a hand or a leg, or it's not a generalized condition, it's regional. And it's a pain syndrome, right? It causes pain, but it also causes other symptoms of pain. CRPS can cause trophic changes to the body, and with that, there's a long list of what trophic changes are, but they can cause a limb to swell, to change colors, to grow excess hair, to have changes in the nails, and if you look up pictures of CRPS affected limbs, you can see, what I mean by trophic changes. But one of the pathognomonic features of CRPS is something called allodynia. Now, what is allodynia? Allodynia is different than hyperalgesia or pain. So hyperalgesia is a state where a person where a person experiences some kind of a painful stimulus, and they experience it as more pain than you would expect. So for example, if I take a needle and I prick a person's leg, that's a painful stimulus, and I would expect a person to yell ow. I wouldn't expect a person to faint and go into cardiac arrest or have some kind of screaming reaction to a relatively small stimulus. That's hyperalgesia. Allodynia is different than hyperalgesia, and this is pathognomonic for CRPS. In allodynia, a person has a pain reaction to a stimulus that is normally not pain producing. So for example, if I took a feather and I rubbed it against your leg, no one would associate that with pain. In CRPS though, the symptom of allodynia is present. A simple maneuver like taking a sock off of a person can induce severe pain. And so that's kind of a general idea. Now, what causes CRPS? There's two causes of CRPS. There's type 1 and type 2. And I'm gonna shoot myself for saying type 1 and type 2, because now I guess I'm expected to know the difference, or to remember the difference and which one is 1 and 2. I believe type 1 is where there is no identifiable precipitant of the CRPS. And so a person just wakes up one day, or he goes, and develops CRPS in a limb. I believe that is type 1. Type 2 is where a person develops CRPS after a specific type of nerve injury. So you'll see people who have had surgery and then develop CRPS, or they broke your leg and then develop CRPS. So there's definitely two types of CRPS. The management strategy for CRPS is very similar to other types of chronic pain conditions. And if you think about pain management or pain medicine, some people think about it from a disease-specific perspective, and I think this group does. I've seen people from the comments really calling out specific types of diseases: CRPS, rheumatoid arthritis, pinched nerves, and so thinking about pain from a disease process perspective, it seems like that's sort of one way to think about pain. The other is from the symptomatic process, right? You can say CRPS. What's the commonality between CRPS and other chronic pain conditions? Well, it's the symptom of pain, right? CRPS would be a lot less significant if we were able to manage and mitigate the pain symptoms. And so if there is no cure, and in CRPS there is no cure to my knowledge, that doesn't mean that the symptoms cannot be managed so that a person can live and feel normal. And the approach to symptom management is very similar to other chronic pain conditions. It starts with the most conservative therapies, right? Physical therapy, exposure therapy, occupational therapy. You could argue things like chiropractic or acupuncture. That's the first kind of bucket of conservative therapy. Then you enter the realm of topical and oral pharmacotherapy. There are numerous types of topicals that can be used, a bunch of different medicines, again, anti-inflammatories, muscle relaxers, antidepressants, nerve pain medicines that can all be used to treat the symptoms. Then there's a category of interventional therapies that can be done. Different types of injections or nerve blocks in that sympathetic nervous system that can be used to treat the symptoms. And then there's finally a class of therapies called neuromodulation, which I won't get into today. We don't have enough time, but essentially we were providing electrical stimulus to some nerves to manage the symptoms of the pain. Great question, and thank you so much, Darlene, for that. We are at time in about 20 seconds, so I will wish everyone a wonderful rest of your day, and thank you for attending. I look forward to having more sessions like this, and I encourage everybody to leave comments if you enjoyed the session. Tell your friends and invite others to our group and community who our community is relevant to. And like I said, feel free to reach out with any questions. And thanks again for attending. Have a wonderful day. Bye bye.